You're watching The Source on CNN Philippines. I'm Pinky Webb. The Philippines has detected its first case of Omicron XBB.1.16, also known as Arcturus. The Department of Health said the patient, who is from Iloilo, did not exhibit symptoms and has since recovered. Let's go straight to the source of the story. Infectious diseases expert, Dr. Rontgene Solante. Dr. Solante, it's good to see you again. Welcome back to The Source.
Hi, Pinky. Good morning.
Let's talk about this. Punta na lang po ako dun sa tinatawag na Arcturus because it's already confusing all these XBBs and these points, sir. But anyway, it is XBB.1.16. The WHO has classified this as a variant of interest. Let's just do a refresh of the definition of terms. What is a variant of interest?
Well, a variant of interest is a variant that has been discovered to be having something that has a growth advantage, so meaning highly transmissible, and at the same time can also evade the antibody for those who have been vaccinated. So there will be reinfections or breakthrough infections for those vaccinated, and of course, a higher infections for those who have not been vaccinated. So those are the two factors why the WHO classified this as a variant of interest. Until such time, more information, more data will be coming in before it will be again declared as the higher variant, what you call the variant of concern, which is the VOC. So it's short of that, meaning this has all the characteristics that it can cause more cases and more reinfections.
So it's two things, because it's highly transmissible and that it can cause breakthrough infections. Also, another thing I wanted to ask you, Dr. Solante, some call this a sublineage or a subvariant. What is it and what is the difference?
Well, it's more or less the same. No, it can be interchangeable. Sublineage or subvariant, meaning it's under a variant of concern, which is the Omicron, and it has emerged from this original variant of concern, mutated further with more mutations in the spike protein. That's why it produces a growth advantage. So meaning it's more transmissible now compared to the original variant or the mother variant of concern, but it's still all under Omicron. Yes.
Yeah. So mas transmissible po siya at mas immune evasive po siya from the original, I guess, as you called it, the mother. Kung saan po siya nag-umpisa yung Omicron. Quickly, how is this, tell us more about this Arcturus. What are there different symptoms that will manifest or you will feel if you are hit by this Arcturus?
Well, based on the report in some countries, there are already like 31 countries reporting this, and they have found out that this is one important cause why some of these countries are reporting increase in the number of cases, but not so significant increase. But again, just because it has a growth advantage, then it is likely that there will be more people getting the infection. The manifestations or the symptoms are still more or less related with the other variants of concern, particularly in this Omicron 3. More of the upper respiratory tract manifestations like sore throat. There are those who manifested with sore eyes, running nose, body pain or myalgia. Some manifest with fever and occasional cough. So, Pinky, the message here is that it's quite difficult to really differentiate this in terms of just the symptomatology with other variants of interest or variants of concern. But the important part here is that this is a virus or a sub-lineage that is totally different from that of the Delta variant of concern, because it binds more to our upper respiratory tract tissue. That's why the manifestation is more an upper respiratory tract rather than a patient presenting with severe pneumonia that requires hospitalization or requires oxygenation.
Okay, we just need to take another short break. We'll be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, infectious diseases expert Dr. Rontgene Solante. Dr. Solante, there's been an increase in the number of cases. Octa Research was saying there's a 13.4% positivity rate in NCR, which is almost ×3 of the threshold of the WHO at 5%. Is this Arcturus the one driving the cases here in the Philippines, particularly in the NCR area?
Yeah, I highly think that aside from the XBB.1.16, no, which is already detected, the other variant of interest is the XBB.1.5, and I think these are the two variants of interest that may be the one responsible for the increase in the cases that we are experiencing now, especially in highly urbanized area here in the Philippines.
Is it time? Would you suggest that maybe we take a look at the mask mandate again and possibly require the using of face masks in even, let's say, indoor areas?
Well, Pinky, we need to look at it this way, instead of the mandate, or because we always have to be in this particular scenario. This is the long-term prediction. The long-term prediction is that we'll always have emergence of these new variants of concern, variants of interest that can cause increase in the cases. But I think the messaging here is that it is still important that we need to follow the health protocol. It may not be a mandate, but it's even more important that we need to encourage people to still wear the face mask, especially in high-risk areas. So there are two areas here, are things that we need to remember. One, the vulnerable population. The vulnerable population should always be aware that even if they are fully vaccinated, they can still get the infection. And unlike the general population, they can still proceed to the more severe form of infection. That's why they have to wear the mask in high-risk areas. Anytime they go to these high-risk areas, then they have to have that. Second, we need to, again, encourage everyone to get their vaccine, whether it's a monovalent or the bivalent, as long as they don't have yet, that we have recommended the second booster for the general population, then we need to do that. So these are important things. We will always remind the general population, the public, that these are important for us to maintain our wall of immunity.
All right. Infectious diseases expert, Dr. Rontgene Solante, thank you so much for your time.
Thank you, Pinky, and good morning.
Good morning. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.